So I have the pleasure of introducing Dr. Ryan McEnaney, who is our invited speaker for this webinar. He's going to speak about extracellular matrix remodeling in arteriogenesis. Take it away.
Thank you, Gail. Thank you, Dr. DiMuzio. Thank you to all the editors of the JVS Vascular Science for putting on these webinars. I think they're just outstanding, and I'm very grateful to be able to be talking to you today about arteriogenesis. I'll be speaking with you about arteriogenesis, and namely the extracellular matrix remodeling that occurs, really that permits the development of functioning collateral arteries. There is a lot I want to show you, and not a ton of time, so I'm going to jump right in. I do not have any disclosures. So for those of you who may not be really familiar with what arteriogenesis is, it really is the process of collateral artery development. This is a natural adaptation to arterial occlusive disease. In other words, when a conductance artery becomes obstructed, naturally within the arterial network, flow patterns shift quite dramatically in some cases, and can exert certain pressures on smaller, in particular, interconnecting blood vessels. The resident cells, namely the endothelium, the vascular smooth muscle cells that exist in those candidate collateral arteries, pick up on those flow pattern shifts and initiate these process of remodeling in order to become functioning and useful collateral arteries. Arteriogenesis, though, really begins in development. It's not possible to develop real collateral arteries without the existence of these pre-existing interarterial connections. There is some number of arterioles which don't terminate into capillary beds within a target organ, but rather connect directly to other arterioles that may be fed from a different parent artery. This apparently is a heritable trait and has been studied pretty extensively in mice and has been thought to account for a lot of the differences in various mouse strains' response to femoral artery ligation. Some mice strain, like the C57 Black 6 mouse strain, is notoriously efficient at perfusion recovery after femoral artery ligation, and is thought to be perform arteriogenesis rather efficiently. But the BALB-C strain, on the other hand, is notoriously poor at perfusion recovery after femoral artery ligation. These animals tend to suffer severe consequences of ischemia, tissue loss, and one of the major factors accounting for this difference is the presence or absence of these pre-existing interarterial connections. I would suggest that in the case of human collateral arteries, being a vascular surgeon, we see a lot of arteriograms. On the left, you see a normal arteriogram, and on the right, a similar arteriogram of a similar anatomical location, but with the occlusion of the conductance vessel. The large collateral arteries shown here are not created de novo, but rather are expansions of these sort of pre-existing connections between territories, namely the descending genicular vessel and muscular branch of the posterior tibial artery. So when an occlusion occurs within a conductance artery, flow patterns shift, as I mentioned, and schematically shown here, a candidate collateral artery, which is a interconnection between two different territories fed by two different parent vessels, will experience a dramatic change in the flow patterns. The initial response to that flow pattern change is activation of the endothelium and vasodilation, but that can only get you so far. To achieve the sort of diameter expansions that we see in collateral arteries, especially functioning collateral arteries clinically, there has to be more of a structural remodeling that occurs. And one of the most interesting things about arterial structures to me is the vast majority of the mechanical properties of an artery boil down to the interrelated interactions between the extracellular matrix components, the two most prominent being elastin and collagen. So to really look at arteriogenesis and the remodeling of the extracellular matrix, we first started by defining what the baseline structure of these blood vessels tends to be. And for anyone interested, we published this survey, this detailed look at the internal elastic lamina and the extracellular matrix in general of various arteries within the arterial tree in the JVS Vascular Science. What I would highlight here is that most arteries, as expected, share a pretty similar structure of the internal elastic lamina being a thick sheet of elastin punctuated by small fenestrations. But certain blood vessels, derivative branches like the profunda or these muscular arterioles have a different morphology in the internal elastic lamina. And that is important, I think, because these tend to be the blood vessels where outward remodeling in arteriogenesis occurs most prominently. Just to expand a more zoomed in look at the structure here, the internal elastic lamina doesn't so much appear as a thick sheet of elastin as it does maybe cords of elastic tissue that are intermittently fused together. The fenestrations or the empty space look more like elliptical fenestrations. Again, I won't dwell too much on this given the time. So with this baseline structure in mind, we used a model that we sort of modified in a rat to really augment pressure for outward remodeling of these collateral networks. Namely, we did a standard femoral artery ligation, but we constructed an arteriovenous fistula distal to it, such that the flow across these territories was really dramatically augmented. And this is very effective at creating larger outward remodeling in the profunda vessel in particular. In the rat, we can see 2.5 to 3 times the diameter expansion over the sham operated vessels. When we looked at similar the extracellular matrix structure, and what you're seeing here, I apologize not spelling that earlier, but these are multi-photon microscopic images on FUS. So we're looking at the surface of the luminal surface of the blood vessel. And what we see is that with this outward remodeling, there's really a dispersion of these bundles of elastic tissue that occurs within the profunda. There isn't so much a change in the morphology of the collagen, however. What's notable, or what I found notable certainly, is that despite the relatively dramatic increases in size and mass of the derivative collateral artery, we didn't really see the amount of elastic tissue ever scale up to accommodate that. Notably, when we looked at evidence of elastic degradation within this model of arteriogenesis, we certainly saw evidence that elastin was being proteolytically degraded with spikes in serum desmosine evident in the first 7 days that sort of falls back to baseline. But sort of back to the my previous point, when we looked at the tissue content of elastin using total desmosine as a surrogate, we did not see any increase in desmosine as I might expect, despite the fact that the vessel itself is increasing in size quite dramatically. What is probably more striking is that the smaller the blood vessel, the relatively sparser the amount of elastin at baseline. The small interarterial connections have very thin bands of elastic tissue to begin with. These blood vessels, on the other hand, when they expand in arteriogenesis in our model, increase diameter sometimes several orders of magnitude, going from 10 micron diameters to sometimes 100 to 200 microns in diameter. When we looked at the resultant internal elastic lamina and adventitial collagens, what we see is in large expansions such as these, we see that the internal elastic lamina appears to be stretched very thin and possibly overburdened with strand breaks evident. Number 4 here, these numbers correspond to this casting of the arterial tree. And number 4 over here corresponds to this these images here, where we see that the internal elastic lamina appears to have been lost entirely. What's notable then is the morphology of the collagen and the adventitia becomes straightened. And this is suggestive of mechanical loading of the adventitial collagens in this situation. This morphology of these very small collaterals that had undergone such dramatic expansion is very similar to blood vessels treated with intraluminal elastase, where the internal elastic lamina was enzymatically degraded. We see a very similar pattern of IEL loss and loading of the adventitial collagens. And that is just described here in very basic terms with an undulation index. Again, if any interested listeners should check out the references where this is published. So in looking at this, we took developing collateral arteries and performed mRNA isolations and RT-PCR. And basically the takeaway from that is that during arteriogenesis, there is a simultaneous increase in expression in both proteolytic factors as well as elastolytic factors and expansion of the extracellular matrix. And a couple of the things that I just briefly want to highlight are the increases in tropoelastin and lysyl oxidase. We subsequently mirrored these findings in human coronary arterial endothelial cells, rather, undergoing increased shear stress in a flow chamber, and found that in that situation, the endothelium is also responsible for producing this increased lysyl oxidase and tropoelastin expression in response to increased fluid shear stress. When we looked at this in terms of arteriogenesis, what I want you to take away is that lysyl oxidase is apparently necessary for the stabilization of the internal elastic lamina during arteriogenesis. So while we don't see increased elastic tissue being deposited, we do see tropoelastin being expressed. And what we found was that if we inhibited lysyl oxidase during arteriogenesis, after the FAL plus AVF model was initiated, that didn't alter the outward expansion, but what we did see was that the internal elastic lamina appeared frayed with numerous strand breaks, and over time we observed that the internal elastic lamina appeared to be lost entirely. Once again, when this occurs, we see that the adventitial collagen morphology becomes altered with straightening of the collagen bundles. And this again implies mechanical loading of the adventitial collagens. So in looking at all this, one question that comes to my mind is, does this outward remodeling in arteriogenesis, does this create a mechanical vulnerability to failure or other degeneration? So I want to call your attention to this image in the lower right, this transitional image from the parent artery, which in the rat is called the superficial epigastric artery, to the profunda. There's a rather abrupt structural change that occurs normally. And then in the case of this remodeling that occurs in arteriogenesis, you see that there's a lot of fraying and a lot of damage that appears in the product IEL. So the reason I bring this up is because there are some clinical entities that are curiously associated with hemodynamic changes and in particular collateral arteries. And so I just wanted to throw out this idea. For instance, pancreaticoduodenal artery aneurysms have actually long been associated with collateral networks in the visceral arcades, namely celiac arterial obstructions are basically considered to be a pathophysiologic factor in the development of PDA aneurysms. And this has been shown in one recent series that basically the majority of either PDA or GDA aneurysms actually results in association with celiac artery occlusion. In another instance, intracranial aneurysms have been long associated with hemodynamic factors. They tend to occur at bifurcations, and there is a lot of literature regarding the hemodynamic factors that cause this aneurysm type remodeling that leads to disruption of the IEL, expansion of fenestrations, and perhaps weakening of the arterial tissue, and that this may be a sort of predisposing factor into the development of these aneurysms. So just to summarize, outward remodeling is necessary for arteriogenesis and collateral development. This arteriogenesis depends heavily on the baseline extracellular matrix structure. Again, interestingly to me, at least, there does not appear to be any increase in polymerized elastin that occurs in the extracellular matrix, despite the sometimes dramatic growth of the vessel itself through remodeling. The maintenance of continuity of the internal elastic lamina then depends on simultaneously repairing and rebuilding the elastic tissue during this expansion, which requires some element of proteolysis. What we have seen, at least in the model thus far, is if the continuity of the internal elastic lamina is lost, then it does not get replaced. The adventitial collagens then become load-bearing and must bear the brunt of the hydrostatic pressure. And then finally, we suggest that the remodeled extracellular matrix may be mechanically weakened or possibly vulnerable to mechanical failure. I want to acknowledge everyone that works in our lab: Dylan, Nolan, Elizabeth, and Rohan, shown here, all my collaborators, and the funding sources for our lab at the VA and the Vascular Cures Foundation. Thank you very much once again for this opportunity to talk to you about arteriogenesis, and hopefully I didn't go too over in time.
So unfortunately, there are a couple questions that are in the chat, but we don't have enough time to openly discuss them without robbing the other speakers. So I'll ask Dr. McEnaney to just answer them in the chat directly.